question is question number 264. It is regarding the portal vein. In this we have to look for the true option. The true about the portal vein is provided with valves where it enters the liver. This option is wrong because the portal vein is valveless. It is valveless. Next option is option B, 80% of blood supply to the liver is by the portal vein. Yes, this is true because 80% is by the portal vein and the rest of the 20% is by the hepatic artery. So this option is correct, 264. Now we reach to the next option, that is C. It is portal vein is formed by union of superior mesenteric vein and the splenic vein at the level of L1. Yes, it is formed by the union of superior mesenteric vein and the splenic vein, but the level is L2. So this option is also wrong. Then D option is both bile duct and hepatic vein is situated in front of the portal vein. This option is also wrong because bile duct and the hepatic artery, these two structures, they are situated in the front of the portal vein. So the answer for this question will be option B, that is the 80% of blood supply to the liver is by the portal vein. Now in this, if we just visualize the picture, this is the formation of the portal vein. In the formation of the portal vein we can see this is the portal vein over here, this is portal vein, and it is formed by the union of superior mesenteric vein. The superior mesenteric vein is coming from here, this is the superior mesenteric vein. The vein which is coming from here, this is the splenic vein, the splenic vein. So splenic vein and the superior mesenteric vein, they unite to form the portal vein, and apart from this another vein is there which is draining into the splenic vein, and this is the inferior mesenteric vein. So the blood from the inferior mesenteric vein also reaches to the portal vein. So this is regarding the formation of the portal vein. If we see the relations in the along the relations with the bile duct and the hepatic artery, this picture shows the relation of, and in this we can visualize that the hepatic artery which is over here, this is the hepatic artery, and this is the duct, the bile duct is there. These two structures are lying anterior to the portal vein. This is the portal vein. So this picture shows the relations of the portal vein to the bile duct and the hepatic artery. Now apart from this, we know that the portal vein is important because it is having communication. The veins of the portal vein which are draining into it, they have communications with the inferior vena cava and the various sites for the portocaval anastomosis. The various sites for the portal caval anastomosis are mainly it is the lower end of esophagus. Then apart from this we have umbilicus, the lower end of rectum, or we say anal canal, apart from this the various other areas are the bare area of liver, the bare area of the liver, the posterior abdominal wall at the falciform ligament, and also at the fissure for the ligamentum venosum. These all are the sites of the portocaval anastomosis where the tributaries of the portal vein are anastomosing with the tributaries of the inferior vena cava, and if there is any obstruction in whole of the venous system, these channels will enlarge and will create an anastomosis and will maintain the circulation. And when we see at the lower end of the esophagus, the left gastric vein drains into which is a part of the portal vein, it anastomoses with the esophageal veins. At the umbilicus, the paraumbilical veins are the one which are anastomosing with the superficial veins of the abdomen, At the lower end of the rectum or the anal canal, the superior rectal vein which drains into the portal vein, it is anastomosing with the middle and the inferior rectal veins. And specifically at these three areas, if there is enlargement at these three areas, it leads to clinical conditions, and those conditions are, for the lower end of esophagus, the esophageal varices. For the umbilicus, we have caput medusae, and for the anal canal, we have the hemorrhoids. This is regarding